My name is Miss Romana Kuchai. I'm one of the ENT consultant surgeons at Imperial College London. I also work at the Medical Chambers in Kensington. I'd like to talk today about nasal obstruction and blockage. It's a very common symptom that features in our clinic. Nasal obstruction can affect one side of the nose, or commonly both sides of the nose, and can affect seasonal or what we call perennial throughout the year. Nasal obstruction can be due to various array of causes, and one of the most common causes in my clinic is in fact what we call rhinitis. Rhinitis is inflammation of the lining of the nose and can be related to allergy. We can provide allergy testing in the form of skin prick testing to give you advice on how to manage those sensitivities if they are in fact positive. Allergies can also be treated with medical therapy long term, including nasal steroid sprays and possibly also allergen avoidance measures. Other causes of nasal obstruction which are very common, including a change in the septum, which is a middle partition in the nose that divides your nose from the right and the left. The septum is very commonly twisted, and sometimes that twist can cause a significant blockage that may be amenable to surgical treatment. There is another cause of nasal obstruction which features commonly in children, and you probably are familiar with what we call adenoids. Adenoids are glands at the back of the nose, and these often can cause significant obstruction to the point of snoring that results in a problem with the breathing within the child, especially when they sleep and lie on their back. We commonly see these conditions, and often we have to give treatment for it in the form of what we call an adenoidectomy, which is not unusual. Nasal obstruction affects the quality of one's life, and it's not unusual to have to seek advice through your GP initially, obtain treatment for it through medical therapies, but in the event that the symptoms persist for more than 6 to 8 weeks, it would be worthwhile seeking an expert opinion from your ENT doctor so that we can enable you to obtain the correct information as to why you have your symptoms. In clinic, we often are able to examine the nose from the front and the back being that in the form of an endoscopy, which can examine for pus or polyps, sinusitis, or even adenoids. If you have any problems that cause concern, we are often able to alleviate your causes and concerns through the examinations, and that is usually the case. Most causes of nasal obstruction are not serious, but please ask for some expert advice if you feel concerned.